today's special, we had a question, and this question comes up frequently. What type of provider should I seek help when I'm feeling depressed or anxious or have pain and depression? There's so many different types of providers and it is so confusing. And so if you would like to learn the differences between different types of mental health providers, especially in US at this time, then stay with me. All right, so what is the difference and which provider to seek? It depends on what stage of health problem you're going through. And I always use this analogy of traffic lights on road of life. So ask, what is the color of light for me? If you are in the green zone where things are going smoothly and there's not too many troubles, then you approach the wellness coaches, then you approach the wellness tools. You go to the exercise, to the gym, you work with improving your, as I say, optimizing your mental and physical health. Coaches come at that level. Then if your light is at yellow, you're feeling stress, some of the symptoms are coming, some of the pain is coming, you're trying to do yourself as much as you can, so do a lot of self-help work at that time. And then if you're still having the issue, seek a counselor. A counselor usually is master's level trained person who is able to help you get through some of the difficulties of life. So those are the counselors. Sometimes they're also called therapists, and there are multitude of integrative approaches, healing approaches like yoga healers, like acupuncture, like massage therapists. And so when you are in that yellow zone, you want to seek those kind of practitioners. And then if you are at the red zone, you have the symptoms are really severe, you're not able to sleep, or your appetite is affected, or your functioning starts getting affected. So you are kind of getting into the clinical disorder type of situation. And in that situation, you really want to seek either a psychotherapist, a psychologist, a psychiatrist, a psychiatric nurse practitioner, or psychiatric physician assistant. These are the people who are kind of higher level trained to deal with more mental, when the mental stress has gone into mental depression or anxiety. And within that also, you start with psychotherapy first. So you go with the counselor or psychologist who can walk you through, identify these mind hindrances that is making it hard for you to heal. And as you're working with the therapist, if they realize that your symptoms are so severe that you're not able to work on some of the healing processes, then you can get support of medication or support, higher level support. And in that case, you should see a psychiatric nurse practitioner, a psychiatric physician assistant, or a psychiatrist. And what's the difference? A psychiatric nurse practitioner is somebody who's gone through the nursing background, and then they do advanced studies to learn to prescribe and function as a physician. So they are called advanced registered nurse practitioner or doctorate of nurse practitioner, so DNP or ARNP. Physician assistant is again somebody who has trained to work with the physician, and then they get advanced training to be able to prescribe basic medications and basic psychiatric treatment. And a psychiatrist is a medical doctor who's going to finish the medical school, and then they specialize in psychiatry, like a medical doctor who specializes in surgery, or somebody who specializes in respiratory disorders or stomach disorders. A psychiatrist specializes in mental disorders. So those are some of the different choices you have, and I would suggest that you take step-by-step approach based on the severity of your condition, and the goal is always to reach to that green zone and to your optimum mental health and well-being. I leave you with this question. Many times people say, well, if I seek treatment, that means I would be crazy. Is it crazy to seek help to get better, or is it crazy to suffer when all the help is available? And so ask yourself, what are you going to choose? Are you going to choose to waste all your life potential on a suffering that may or may not be in your control? Or are you going to take an empowered step to get yourself the best help possible, whether it is self-help with the coaches or a counselor or a medication provider or advanced psychiatric provider. On that note, stay safe, happy, and healthy. Every day is a new day. Keep making the best decision every day. Take care.